Hi, this is Megan with Dyslexia on Demand, and in this video you're going to learn about the essential components that need to be present in any evidence-based dyslexia intervention programming. Although there are several evidence-based dyslexia therapy programs out there, they all should have common themes. There's not one magical program that works perfectly for every child every time. This is why I feel that we place less emphasis on the curriculum, assuming that they're using evidence-based dyslexia-specific curriculum, and we need to place more emphasis on the quality of the dyslexia professional and the fidelity with which the program is being implemented. If it is evidence-based in research, this means that there's proof in the pudding when the program is delivered with fidelity. When the dyslexia specialist is highly qualified, they can take a less effective program and make it more impactful for the student using their professional expertise. Effective programs for dyslexia should be designed with the same common elements. The term Orton-Gillingham tends to be a household name when we're discussing dyslexia. The term Orton-Gillingham, or OG for short, simply put means a multi-sensory approach to literacy instruction. This is one of the core features of any dyslexia-specific programming. The dyslexic brain requires a different instructional approach than a neurotypical reader, and a lot of this incorporates integration of the visual, kinesthetic, and auditory components of instruction. Isn't that really just brain science? Everything that you do in a multi-sensory approach is going to resonate better and will be more long-term. I could read a recipe and understand how to make it, or I could cook the recipe. Which one do you think your brain is going to retain better? Explicit literacy instruction means the black and white rule-based reasoning of the English language. Another word for this is that important buzzword in literacy instruction these days called structured literacy. Structured literacy is both explicit and systematic, and this is one of the elements that is missing from the more traditional balanced literacy approach in most classrooms. Despite what most people think, the English language is 80% regular, meaning it makes sense to explicitly teach the rules of decoding and spelling. Not only should dyslexia instruction be explicit, but it needs to be both systematic and cumulative for true structured literacy. The plan for instruction that is systematic is carefully thought out, builds upon prior learning, and is strategic building from simple to complex. It's designed before activities and lessons are planned. Instruction across the 5 components: phonemic awareness, phonics, fluency, vocabulary, and comprehension. The student should never be exposed to anything that they have not already explicitly been instructed on previously, and hopefully shown proficiency, if not mastery. This is one element that can be truly confidence building for children, since it helps to unlock success. The last, yet critical element of dyslexia intervention is that it needs to be high repetition. The dyslexic brain requires several more exposures to literacy instructional elements than the neurotypical reader. This number of exposures truly varies per student, and this is one of the reasons it's critical that you need a certified dyslexia specialist driving the ship. A concept should never be introduced and then left. Quality programs have past concepts continually reinforced as they move forward with new instruction. At Dyslexia on Demand, not only do we exclusively hire certified academic language therapists who are the top level of dyslexia therapists possible, but we implement only therapeutic grade, evidence-based curriculum with fidelity. Specifically, the Take Flight program created by the Texas Scottish Rite Hospital for Children. Our one-on-one approach is individualized and prescriptive to the specific needs of every child we work with. When you work with Dyslexia on Demand, you can trust that our expertise, individualization, and therapeutic programming set us apart. Please visit us at dyslexiaondemand.com to schedule a personal meeting with me to learn more about how we can change the life of your child. And please like and follow for more educational videos like this.